Cassidy, it's Sam. Why don't we give folks just a couple more minutes to get online and then we can get started.
Sounds good. Welcome, everybody. We're going to get started in about a minute to allow a few folks to join the call. Just a reminder, if you are not speaking, go ahead and mute your lines. That way we can reduce some of the background noise for the recorded call today. Thank you. All right, welcome everybody. We're going to go ahead and get started. This will be the 5th learning session for the Prehospital PECCLC Learning Collaborative. My name is Cassidy and I'm just going to introduce the call real quick. Bear with me as I read the required disclosure from HRSA, the Health Resources and Services Administration, Maternal Child Health Bureau, EMS for Children program is supported in part by the HRSA, the U.S. Department of Health and Human Services, under grant number U07MC29829. Before we get started, and I turn it over to Sam for the agenda and the content today, as I've mentioned a few times, the call is going to be recorded, so if you are not speaking, if you could just remember to go ahead and put that phone on mute, that'll help reduce some of the background noise and static that we do hear so often on these webinars. Remember, there is a difference between mute and hold. Definitely go ahead and utilize that mute button, as hold will sometimes have background music. If you have questions, feel free to enter those into the chat box, and we'll go ahead and moderate those at the end of the call. But you can always, you're always welcome to wait until the end of the call as well to ask those questions in person. That being said, I will go ahead and hand that over to Sam, and he will introduce the agenda. Thank you very much.
Thank you, Cassidy. Welcome, everybody, to the 5th and final learning session of our PECC Learning Collaborative. Woohoo! So just to go over the agenda here for today, we're going to go over the state of the collaborative. Then everybody will get about 5 minutes to kind of go over what their biggest lesson learned from the collaborative has been. Then we will want to go over the qualitative assessment that was mentioned in your NOFO, and we'll talk a little bit about that. And then we will spend a few minutes just celebrating everybody's success. So our learning objectives for today is just discuss the biggest lesson learned from the collaborative and present your sustainability plan for the next 6 months. So the information you see before you is current as of this morning, actually probably within the last hour, and is taken from the information you reported. Excuse me, the only information I don't have is from Rhode Island and New Mexico. But as you can see here, the overall goal has been adjusted since the last meeting and that's been according to some recent numbers that I've received, but you can see it hasn't really made a huge difference. So the overall goal is 341, and you can see that we have 316 PECCs recruited, so that is right at about 93% of the overall goal. So that is pretty amazing, pretty amazing. So congratulations to all of you. You've done excellent work in such a short amount of time. And I know that for this portion of the agenda, we only have 5 minutes scheduled, but since we're here today to celebrate your success, I think it's important that we don't just celebrate the success collectively, but your individual success. So I also have these state slides that I want to show you. And for Connecticut, this information is current as of today. That Connecticut's goal is 26, and currently they have recruited 39. And Victoria, if you're on the line, just to confirm that that number is accurate. But I don't know if she's on the line or not. Okay. We'll go on to New York. New York's goal is 60, and their current number is 54 that they've been able to recruit. So congratulations, New York. Excellent work.
Thank you.
Rhode Island, Carolina, I see you're on the line. Is 51 still accurate, or have you been able to get those last 4 on your list?
For transporting agencies, 51 is still accurate.
Okay. Hey, but you know what? That's great work. And
we have 62 in total for the 88 agencies.
Okay. So is your overall goal 62 or is it 55?
We have 55 transporting 911 agencies.
Okay.
I guess I said 100%.
All right. Well, you all have done an amazing job, especially being able to get it passed in rule. I think that's amazing. So, congratulations to you guys. Next up is Wisconsin. You can see their goal is 36, and they've been able to recruit 27. So, Jason, you guys have done excellent work there, especially in these last couple of months. And just to make sure, 36 is your goal. Is that correct?
36 is our goal, but I have 37 that I had. If I didn't send you the right numbers, I apologize.
So you've actually recruited 37, is that correct?
Recruited 37, correct.
Oh, wow. Well, that's great. Let me make a note. So you've actually added the 27 folks since the end of February?
It was, and I'll explain when I go through my speaking, but it really, the last couple months, we didn't count them until I had the MOU in hand. We had verbal commitments, but now I've actually got a signed document by the service director and the PECC coordinator stating that, yes, they're on board. So this last month with the last couple conferences we had really helped, and I'll explain that when I get into my report later.
Okay. Hey, well, excellent work. Congratulations. And then Montana. Whoops, I skipped over that. Sorry. Montana, you all have just taken off tremendously here. I have your goal is 33, and you've actually recruited 51 folks overall. So, and just to make sure that that's accurate, is 33 your goal? Is that accurate? Jason and Robin, I see you're on the line here.
Can you hear me now?
Yeah.
All right. Actually, our stated goal in our grant application was 60% of those that responded to the NEDARC survey, which was a really aggressive 116 services.
Oh,
so by our stated grant, we're not where we'd like to be, but we're still really excited at the progress we've made in such a short time.
Okay.
So what's the number now, Jason?
The total number between the ones that we verified that said they had a PEC on the NEDARC survey and the ones we've recruited cold is 78.
So, but is 51 just the number of brand new PECs that you've recruited?
Yes, those are the ones that came from 4 groups. They said they were interested. They said they had plans. Those that said they had no PEC, and then those that didn't respond to the survey at all.
All righty. Hey, well, you know what? Y'all have still done amazing work here. I mean, look at what you've been able to accomplish in such a short period of time. So. Oh
yeah, and we knew that Robin's goal was very optimistic, and we're still going to hit it, just not within this time period.
Absolutely. Well, congratulations to you guys. You've done great work.
Thank you.
New Mexico, I know that Catherine, she had to attend a funeral today, so I have not gotten an update from her, and I don't know if there's anybody else from New Mexico on the line or not. I will take that as a no, but she took her time putting together her communication plan, and you can see that once she implemented it, just within that short period of time, she already got 10 people. So I know that that she has probably, from what I understand, has probably recruited at least an additional 10 to 15 people since. Ohio, Joe, you've gotten 25 so far, is that correct? And 38 is your goal?
Well, it depends on how you count them. But total, what I had sent in to you yesterday, we have a total of 60 that are registered either through our website or the ones that we verified earlier on in the process, the ones that had said yes on the survey. So we have an overall total of 60 that we have verified.
But how many is 25 the number of brand new ones that you've gotten since the beginning of the collaborative?
I don't know where you got that number 25 from.
The report that you sent me.
Well, I sent you a couple of them. I updated the one, and it included the folks who had said yes on the survey that we verified back at the end of January.
So how many brand new PECs have you recruited since the beginning of the collaborative?
60.
60. Okay.
Yes.
Great. Well, that's even better. Great work.
Thank you.
And let's see, Pennsylvania. I don't know, Dwayne, if Dwayne's on the line or not, but Dwayne, are you on the line? I know that he may have had an issue participating today. Is anybody else from Pennsylvania on the line? Well, I can tell you we did a site visit with them last week, and they're doing amazing work up there as well. And I know that they will meet their goal here very shortly. And then last but not least, we have Kentucky. Morgan has done an amazing job down there, and she has been able to recruit 40 out of 48. So Morgan, awesome job.
Thank you so much.
You're welcome. Thank you. So with that, I will turn this over to Dr. Auerbach. But Dr. Auerbach, just to let you know, we do have a presentation, a PowerPoint from New York. If you wanted them to go ahead and go first.
Excellent. Well, I want to take a second to congratulate everyone. I know that a couple people joined late, so Vicky and Morgan and some others that I saw your names popping up there. Amazing work. Sarah is going to be sending everyone pizza and chocolate cake. It might be virtually via emojis, but she did get approval, to do that. The numbers to me look like and sound like they may be very close to tipping the target based on what we just heard. So really fantastic work, and it's really hard to believe that we are able to hit this, what I thought was a very aspirational goal. So amazing work, really proud, and I look forward to hearing some personal stories and updates. So really, I guess what I'll do is just facilitate some discussion. There are some individual teams that did share some slides, so we'll hear from New York to start off. What we'd like to hear is new PECCs over the last month or so, biggest takeaway from the collaborative experience and lesson learned, and then at a high level, your plans for the next 6 months of this work. So we could start with New York. Thank you, Sam.
Alrighty.
So you can go to the next slide if you want, Sam.
Alrighty.
So we have recruited 34 new PECCs since March, a total of 54 overall. As we shared with you guys last time, we spent probably the first 3-4 months actually working with the state team to come up with what is a PECC. So that took us quite a bit of time, but I do feel that because we took that time and got people's input, that we've had really good success with that. Of the 44 who responded they've had a PECC or had a PECC, 4 of them have given us attestation, but that is not counted in our numbers. Next slide. Lessons learned. Again, our biggest challenge, and I'm sure Sam and Terry will attest to this because I had numerous calls with them, is the challenge of defining what a PECC was. I personally was having a lot of issues with it. We got that big list of 10 and trying to figure out what a PECC in New York would look like. And through the process of doing quite a few webinars and surveys, we've been able to define that pretty clearly, and I think we've shared that with all of you guys. The other thing that was kind of one of our big lessons learned is recognition of a PECC can be extremely simple. And again, this came from doing surveys, but they're looking for their name on websites, Facebook posts, and I'm going to be honest, a little competition. Every time we put out a congratulations to an agency via our website or such, we seem to get 2 or 3 new PECCs or people who call us about doing a PECC. And again, within our next 6 months, we've requested our carry forward funding. We are going to be, again, establishing a newsletter to all those established PECCs, again, giving them clues on how to create social media posts, press releases, how to do things in their community so we can kind of keep it fresh in the PECC's mind. We're also going to do a social media push. The team here has kind of deemed it nice PECCs. So when they're selling that to the people, they ask people to use the hashtag nice PECCs. And we just continue to work on our sustainability plan, which is to actually involve Pediatric Prepared in our standard of excellence. And one of the things I can, commend our Bureau of EMS is they have decided that it's such an important thing that it will be the introductory level before anybody can even apply for a standard of excellence, is that they need to be Pediatric Prepared. And that's about it.
Wow, great work, Martha, and I like the nice PECCs hashtag. We'll probably borrow that along many other things that we've learned from your state. The registration site that they've created in New York is also a really nice way as we look at guiding other states about how to do this. But really fantastic work, and we look forward to continuing to learn from each other and learn from your team over the next 6 months. Who's up next, Sam? Pennsylvania. So I don't believe anyone's on the line. Do you want me just to walk through these, Sam?
Yeah, that'd be fine.
Okay.
Sure.
So the number of PECCs and the total number of PECCs added are listed there. The agencies participating in the project are 55, and there's another 36 that have expressed interest but have not yet identified a PECC. You can go to the next slide. A takeaway from this project is asking any EMS service to do more without targeted support in today's healthcare environment is a tall task and a big ask. So asking without sustenance and content and resources for them and allowing the ask to be made outside of your control might yield negative results. So one of their lessons was having a credible and functioning program and resources in place, including communications plan before adding the numbers, and the early effort will yield better long-term results and engagement in the program. Next slide. Their next steps are to continue meeting with their PECC steering committee and continue their efforts through September 2019, and then transition that effort to the state of Pennsylvania EMS steering committee. So in this state, there were actually two different steering committees working together in parallel on this. They're going to continue to develop their website. They're going to continue to develop how-to resources and pragmatic tools that the PECCs can use for implementing or enhancing components of the PECC role and responsibility documents. And they're going to promote the PECC project through media and in-person sessions. Next slide.
So that was actually the last one for
Okay.
Pennsylvania.
Yeah, so going back to Pennsylvania, I do want to add a couple of takeaways that Sam and I took from our meeting with them. So Sam, you may have others. Two really high-level takeaways that I don't think I had framed before were the potential to leverage the PECC role for people that may be on disability, or I know there's a better name for that, but basically people that can't lift heavy things and potentially can't be out in the field. And some of those may be at the towards the end of their career, but they may be earlier in their career and have long periods of time where they may be able to serve in this role. And the other thing that came up was creating a sort of launching pad for PECC, so working to involve early career responders and paramedics to get engaged in a potential future state where they would be a PECC. So breeding those people for that role sometimes in the future. Those were, I think, two important contexts of thinking about not just throwing the net wide at everyone, but potentially targeting those two audiences of the very junior providers with this as a future career path, and then potentially the more senior providers as and or injured providers as a way of still contributing substantively to their agency. Sam, does that summarize that well? I know there's some lingo related to injury and stuff that I probably screwed up there.
No, that's fine. No, actually, everything you covered was all the things that I had in mind as far as highlighting from that. Just one other real quick thing that I think everybody has done a really good job of is, as far as the sustainability piece, is just to continue that collaborative effort with all of your state chapters of your organizations such as AAP, ACEP, all of your state EMS agencies, all of those folks, to help you spread the word, especially when there's really no funding available to help you out with stuff.
Thank you. So we could move on to the next state. Thanks. Is that New Mexico, Sam, the next one?
It could be whoever you choose.
Oh, okay. So I'm just seeing the slide that says qualitative assessment. So was this a placeholder to have that discussion related to qualitative assessment?
Yeah, that's just a placeholder for the next discussion. So we don't really have slides for any of the other
Okay,
states.
excellent. So why don't we scroll back a few slides just so we hit the talking points, and maybe we could start with Rhode Island, just because I see Carolina's name in the chat box, but going back to the three items we wanted them to cover before New York slides there. So Carolina, if you can share those three items, doesn't need to be long in detail, but just looking for high-level reflections in addition to, so how many new PECCs, biggest takeaway or biggest lesson learned, and then plans for the next 6 months.
Yep, no problem. Hi, everyone. Hope everyone's doing well today. So in terms of the new PECCs, the way I structured the program was a little bit different. So I had no intention of recruiting PECCs on a monthly basis. But what we did do is we made like a large recruitment back in November. And so I just wanted to share a little bit of, so we had 38 people who committed to participating in training. And we had 19 people who did 50 hours of pediatric training, whether including PALS, PEP, and simulation, and family-centered care. And so that was about 50% of what we had planned for. And we had 13 who didn't complete any training, and about 6 who are halfway there but have not met the 37-hour requirement. So our minimum to be PECC certified was 37 hours. But we had 21 who completed up to 50, so we have 20 new PEP instructors and 20 new PEP PALS instructors. Biggest takeaway, I should have planned for competing priorities. When I wrote the grant, I had pretty much, I don't want to say nothing to do, but very, very little, and we got a new grant that kind of competed with the PECC Learning Collaborative, but the plan was very well in motion when that all started, so it was a good opportunity. So that was more on my personal. In terms of the program, I underestimated the passion for pediatrics. I think we were surprised by all the people who were willing to actually put themselves out there and complete the full training. And then time and money makes a difference. Having all the resources that we had and the time to actually have these people over the past 6 months go through the training made a difference. And they've actually expressed, like, if this continues, they're willing to commit. And I think other agencies who didn't catch the boat at the beginning in November are kind of regretting it and saying, you know, we want to do this. And we didn't pay them. We just paid for the training. In terms of what I'm doing over the next month, finalizing grant objectives, there are things that I was not able to finish. Our PECCs are going to graduate on EMS Recognition Day. We're going to have a ceremony for them on May 24th. If you want to come to Rhode Island during EMS Week, you're welcome to come to the celebration. And we're definitely evaluating the program and thinking about outcomes. So over the next 6 months and into the next 3 years, how can we kind of look at the PECCs that currently train, look at their agencies, did they replicate the training within their EMS agencies, and how does this impact the care of pediatric patients in Rhode Island? Great. That's everything.
Thank you so much. Really great work there in Rhode Island, and I think the next person up is going to be Jason Mahoney. He wins the best excuse where he has to get on a ambulance, I believe. So he will go next. Thank you.
All righty. Are you able to hear me?
Yes, we can.
Yeah, go right ahead.
Great. Thank you. All right. So we already kind of hit on it, but we added 21 PECCs in March. For a total of 78 total. 27 of 43 of the agencies that said they had a PECC and verified with us. 51 total new PECCs since about the 15th of October. The big takeaway for us, kind of mirroring what has already been said, is that we have to give back. We have to have incentives. We have to have something that makes it a little more worth their while for agencies to designate a PECC. Not that they aren't interested in taking better care of kids, but with all the competing priorities, we have to do something that stands out. So we're a little late to the game on that, but we used the incentive idea to our benefit starting about halfway through. So every agency that designated a PECC is going to receive a box of pediatric equipment and supplies. Those larger agencies that don't necessarily have a specific need for that, many times will use that for training supplies. But most of our smaller agencies are actually putting that equipment and supplies, those equipment supplies, on their ambulances. They're using many of them, that equipment, to build pediatric bags and things like that. As part of our grant application and the process that we've gone through, we've scheduled 3 PECC conferences regionally throughout the state. We've completed 2 of them. The last one will be this Saturday. They've gone up very well. And as an incentive to send someone to to one of those conferences, they receive a pediatric mannequin that's all AHA compliant with a CPR quality feedback device, and has gotten great feedback as far as giving them something to help with their training programs. The other incentive along with those conferences is that we paid mileage for folks to come, and for those that came farther than others, we were actually able to cover their lodging to ensure that they were able to show up. So I forgot to total those numbers, but we've had somewhere between 50 and 60 people attend the first 2, and we expect another 20 or so for the third one coming up this Saturday. Just a quick bit on that, and I'm more than willing to share what we've done with our conferences. But our general agenda for that is an introduction, some networking, and a short discussion of everyone's experience, just to kind of get past everyone's statement that they don't see a lot of kids. We go around the room and let them say it once so everyone understands that it is truly and thankfully a low occurrence event. Then Robin takes a few minutes and goes through the state resources that are available and hands out a ton of amazing resources to help these folks really dig in as PECCs. After that, we go through an updated version of the presentation we gave in Austin so folks kind of understand the process we've gone through, and we've gotten some great feedback and suggestions on our process and how we might make that better. Then it's about lunchtime, so we've been ordering pizza for everyone, and during that working lunch, we put on a presentation on pediatric safe transport, where we demonstrate a number of ambulance-based pediatric restraint devices for everyone. After lunch, we go through a little bit of our pediatric scenario guidebook, and depending on how much time we have left, run some scenarios. But the big benefit there, since everyone basically has the guidebook already, is thanks to Dr. Auerbach, we have introduced them to the PEARLS debriefing tool. We've gone ahead and printed and laminated their debriefing poster or a handout. We distribute that to everyone, and we get double bang for our buck. Then we teach people how to use the scenario guidebook and how to run scenarios if they've never done that sort of training. And then we also use that to do kind of group debriefing and walk folks through the process using that PEARLS tool, which has just gotten some really, really good feedback. And I think a lot of our PECCs have left the conference feeling much more confident in really getting some good return on their time for running some PEDS scenario training. What else? As far as our 6-month plan, we're basically planning to continue what we've been doing. We're going to keep working on EMS recognition, and to reach the second of 4 levels, a service has to designate a PECC. So continuing to recruit PECCs is built right into that process. As well as we've gone out through the conferences and just made contact with so many agencies that we haven't interacted with in a long time, made them aware of our capability to provide free on-site training. My calendar for the spring and summer is nearly all full already. I'll be traveling the state, providing on-site, both classroom-based and scenario-based, simulation-based training for a lot of different services, and I'm sure throwing in some hospitals as well while we're out. Another thing that we're doing then is we're starting to do a little more concerted work around PEDS disaster preparation, both pre-hospital and hospital. With my background in emergency management and emergency preparedness, I'm starting to work with some agencies and a few facilities to really beef up their pediatric annexes to their emergency operations plan. And kind of to support that and highlight the need for that, I'll be starting next month in April, running a virtual tabletop exercise series, going to be a bus crash scenario with a lot of kids from out of town. So EMS will be working on identification and triage of some of those patients. And since we did a related exercise 2 years ago that focused more on clinical care, in the hospital side, this exercise is going to focus much more on identifying pediatric patients and then going through the reunification and family assistance center processes that we know is a major gap throughout the state and probably the nation. One of the tools we're going to use to help them move forward then in their after-action reporting and improvement planning is the American Academy of Pediatrics reunification toolkit that came out almost a year ago. So going to be a very busy summer, and we plan to keep adding PECCs and just push forward with all the great stuff we've been doing.
And Montana is also going to request carryover. And then we're also doing EMS week on May 23rd. We will acknowledge all the services that have been formally recognized as pediatric at one of the 4 levels. And then we will also do a quarterly PECC liaison conference call and quarterly webinars so that we will keep engagement going with the PECCs that have been added. And yeah, Jason said that he will be on the road for the next long time, and I like to tease him that he has to put in at least 1,000 miles a month.
Great work. So I'm not sure if Jason's still on. I did have a question in terms of you're doing a tremendous amount with this funding. This is Mark Auerbach. In terms of the CPR Feedback Manikins, was that something that additional grant funding is supporting? Because those are, my understanding is those are a couple $1,000, and I was just curious how you were providing them to all the PECCs.
No, what we did, they're 120. They're just the CPR manikin, a child CPR manikin, which has colors on the side of it, like on the shoulder, where it just gives you a color-coded light that says that you're doing good, your compressions are good. So we went real cheap with them.
Great, and if you could share which mannequin, that would be great, because certainly the ones with the digital outputs are quite a bit more expensive than that. What company is it?
It was Preston.
Great, thank you. All right, we can keep going down the line. So yeah, if by any chance you could share a link to that even in the chat box here, that would be great.
Sure, I'll look it up.
Dr. Auerbach, are you still there? I think we lost you.
I might have gotten cut off, so I said if we can hear from Morgan now, that would be great.
Okay, hi everybody. Pick the phone up because the sound will probably be a little bit better. And let me pull up. I didn't send in my slide set. Not a lot has changed for us. In the last month or so, we've had some other priorities that have taken place or taken first place on my list of things to do. So we have added a couple of PECCs in the last month. What I consider my full total is 58 right now, but that includes those that we've confirmed out of the original group that claimed to have a PECC. So we've added 40 out of the 48 that we wanted to add that were considered new. I feel like we really hit a big bunch of PECCs added in very early on that responded well to emails. So we probably grabbed sort of the low-hanging fruit, the ones that were going to be relatively easy to convince there in the beginning. We've had some challenges in working on our state team in getting the paperwork done, just getting everyone to sign off on the MOAs and return those. Right now I'm trying to squeeze substitute W-9s out of everybody so we can get those processed appropriately. And that's just hard to get people to do paperwork. So that's been the biggest challenge on that side of it. And we've, again, hit a slowdown as far as reaching out to the people that are a little maybe more resistant. And I feel the plans we have for the next 6 months will really help us, I think, kind of cross that bridge and get to the next phase. My state team meetings have been going well as we have those little regional kind of PECC representatives that are doing outreach at the local level, engaging in calls together. And sharing information, and there's a huge amount of interest amongst that group in increasing the amount of pediatric education that's available. And we've started talking about, we have one service that's working on this project with us that has a fair number of PEP instructors. And we're actually going to hold a PEP provider class for just the state team members that are interested in moving on to become PEP instructors. And increase the number of instructors that we have to pull from. as well as some of the services and PECCs that are participating are going to host additional PALS and pairs classes in their area, and I'll be able to provide some books for those courses to try and increase those educational opportunities. The in-person meetings that we have, or we're starting to plan, will take place later this summer. And those will be little regional meetings with myself, this regional PECC. Sorry, I'm getting my language messed up. Those regional PECCs reaching out to the services surrounding them and asking them to send somebody, for we can really have an in-person discussion about what a PECC is, why that role is important, what the benefits are to your service in naming that individual. And then ongoing meetings and collaborations that can take place once we have those individuals named. And I think we'll see more participation at that time once we have those in-person meetings. And then I'm continuing with my plans to do, right now we're planning every other month. They may switch to quarterly if we feel every other month is too frequent, to where we will have a combined in-person / available through webinar meeting just for the PECCs to attend, where they can network and share information and challenges, learn more about education, little methodology of instruction type training, managing skills competency evaluations, in-depth clinical information, and just that peer-to-peer relationship building that I think will really help carry us through in the long run. And we're really, truly just getting started with our field staff that go out and do agency inspections and getting them briefed on strongly encouraging agencies to name a PECC if they have not done so at this time. So I think as they continue those annual inspections this summer, we'll see some numbers grow in that group as well. But it's a lot of just trying to find the time, really. The money has been helpful in engaging a group of people on this state team, trying to figure out ways to continue to offer some sort of support without direct monetary compensation in the future, and continue that engagement. And I think the ones that we have on the state team right now tend to be leaders within their area amongst services, and I think that will really help drive their continued engagement beyond the project period. So that's all I had for the moment.
Hello?
Hello?
Hi, can you guys still hear me? Sorry about that. My connection seems to be a little bit off today. So great work. Thank you so much for sharing that. I think a theme that I'm hearing is competing priorities from a number of the groups. But even with the competing priorities, it's really amazing how you've sustained a focus on eye on the prize kind of here. Who do we want to hear from next, Sam? I don't know if you want to go around the horn. I'm trying to figure out who's on the line, and I'm having trouble getting that box to open up. So I know I know at least Vicki is, so perhaps we can hear from Connecticut next, and then you can let me know who else is on the line.
Sure.
Okay. Hi, everybody. Good morning. Good afternoon. We recruited 6 more PECCs in March, 6 new ones. So that brings us up to about 45 brand new PECCs. And then 22 agencies that reported having PECCs when we did our initial survey. So biggest takeaway, again, like everybody else, it's time. I could pour my whole 40 hours a week into this project. There's a lot of enthusiasm out there about it, and I'm very passionate about it. So like everybody, time is a factor. And also one of our regions, we have a 5-region system here in Connecticut. And Region 1 has been really engaged, and they want everything. So I feel like I've spent a lot of time there, which is fine, but, we have to get around to the rest of the state. But they're the most communicative. They get back to my emails and phone calls very quickly. So I guess from a low-hanging fruit perspective, that was good work. But now we'll have to reach out to other parts of the state as well. And another challenge is we're doing a lot of our own teaching, so that takes some time, but it's been a real eye-opener for everybody out in the community about what is available, what type of pediatric things they don't know, and they're, coming away from class with new ideas and new education that they're actually able to carry over throughout, all ages and populations in EMS. So that's gone really well. Over our next 6 months, we have a lot of things going on. We'll continue with our PEP courses. We've also started back our neonatal resuscitation courses. We're working with the neonatologists at Yale University, and they've modified the course somewhat for paramedics, and we've been receiving really great feedback on that. The other thing that we're doing is we're partnering with the Connecticut chapter of the American Academy of Pediatrics, and we're going to be working with them to, going forward, put on several sort of more live type webinars that'll be more interactive, that will not only teach about what a PECC is and what some of the responsibilities of a PECC are, but also some of the resources that are available and some of our upcoming training opportunities. And on each of those calls that we plan to do probably every other month to start, we'll have a content expert on a different area of pediatric medicine. We'll continue with our courses. We've had a lot of momentum and a lot of interest, so it's not going to be a problem for sustainability or continuity of the program. So we're looking forward to seeing how many more PECCs we can get. Right now, PECCs are happy with just the training, but I know at some point we'd like to, give some sort of incentive or a reward for all the time and effort that people are putting into this. So we have a lot of work to do on this project alone, but we're happy to do it, and I'm really proud of our whole EMS system in Connecticut. Everybody's been wonderful to work with. That's one other challenge I have. We have a great advisory committee, but I haven't gotten everybody to be able to get on one call or in one room. So we're going to keep working on that, but I've had several meetings with individuals and partial people on the committee, and we've gotten a lot of great feedback, a lot of great comments, ideas, questions. So it's really been wonderful to work with our whole group in Connecticut.
Thank you so much. Looking at the remaining groups, who I see a lot of phone numbers. So if you want to just let me know who else is on the call or what teams we have left.
So it looks like we have Wisconsin and Ohio left.
Great. So someone from Wisconsin?
Yeah, good morning, good afternoon. So the month of March has actually been kind of a big one for us here because we're kind of finalizing and pushing. So we had 28 that gave us their MOUs. Again, these were ones that we were talking to since, the beginning of this, that we reached out and stated, at our conference in January, we'd like you to come on board and be a PECC and start giving the information. And now we're finally getting our MOUs. So the biggest takeaway from that is it's really face-to-face communication. I had learned that an email, even to close friends, is still suspect to more questions than they're willing to ask over by email. So when I was able to reach out and talk to them face-to-face or by the phone and explain to them that we're not asking for their firstborn, that it's not going to increase unnecessary workloads in their departments, they were more willing to be on board. Also, the second takeaway is to have something for them. The mini grants helped, and what we did with our mini grant, as I explained in January, was that we were just allowing the services to take that amount of money and buy what they needed for the department. And looking at what they've come up with the feedback pediatric infant Cpr Manikins. They've bought simulation time in some of the local simulation labs at the universities or the bigger facilities, and a lot have gone with the pediatric immobilization devices, and then also the car seat applications, or like the Furno Pedimates for their stretchers. So that's also looking at, what do we need to discuss and what are some other forward action items that we can do for education. We are finding when we're at the conferences that a lot of services are just simply putting the baby on the mom's lap and strapping the mom into the stretcher. So it's given us some more ideas through EMSC what to do for education. Our education is going to be centered around the PECCs now. So when we go out and do regional educations, it will be for PECC services and working around them initiatives and getting sign-offs on their skill sets. But learning from the collaborative, I learned that we're a big nation, but everybody has about the same issues. It's time, it's money, it's changes in volunteer status. So we're really working on that. And when we had kind of a aha moment the other day is that we're looking at throwing resources maybe in areas that don't need to be. So we're going to look at population basis throughout the state of Wisconsin and see where, the pediatric populations in the regions. And we're just going to get started working on that now in the next 6 months. Recognition, developing that banner for the website on who's a PECC, making sure that we have a list of who's not PECCs. When I was at a conference last week with our booth, finding out services that as they were walking by, I had a list and it's like, I need to talk to you. So I had that conversation with them and we were actually able to get some more on board that will be working with us in the next few weeks. The next steps that we're going to do for the next 6 months is shoring up our website, getting that set, getting the toolbox set with the items that our committee has discussed, such as the state resources, the education resources, the names of the PECCs that are already there, and making the PECC sustainability, giving them something. So now we go out and talk to services about PECCs that we say, this is what we have to offer you, and it's actually up and running and getting word of mouth going through the services that are doing it. So we're really looking forward to it. We had a really good site visit and meeting, took a lot of things away from that we're going to be putting into motion. And Jason mentioned before disaster management for pediatrics. We had a large event here in a few weeks ago that had a massive pileup on the highway where there wasn't a lot of injuries, but there was a lot of pediatrics in the vehicles. There was 100 vehicles, and it really brought the light on what can we do for reunification and how do we track these pediatrics. It was, again, lucky enough that there wasn't a lot of major injuries, so we didn't have that issue, but it really snapped the light on for our hospital emergency coalitions and our RTACs and the EMSC to work on getting some disaster preparedness, specifically around pediatrics. That's all I have right now.
Thank you, Jason. Is Ohio on the line now?
Yes, we are, and I'm going to apologize ahead of time. There's a retirement party going on that's in the hallway directly opposite me, so if there's some background noise, you know why. In any case, just starting out with numbers, we added an additional 13 in March for a grand total of 60. But I actually figured out where Sam's 25 number came from. Those are the ones that didn't indicate that they were that they had a PECC on the survey from last year. So that's how that division ended up. I think that's one thing to take away from this, although not the biggest takeaway, is we need to make sure we know how we're defining that for ourselves internally for this on what counts, what doesn't, how it looks, how it gets measured, all that fun stuff. I would say that our biggest takeaway overall from this is simply that 6 months is not enough to create a program like what we're trying to do, and that's really what we're doing is we're program building as opposed to counting who has someone at their agency or that. We're trying to build something that's going to outlast the grant period, whether it was 6 months or a year and a half or whatever. So I think that's really the biggest takeaway is our focus in large part was on building something that was going to last for a significant amount of time, and we were trying to do it in a very, very narrow time frame to put together. So I think really whatever successes we've got have been fantastic, but I think the big successes are going to be how we move forward from this and how this gets taken out to our EMS communities. So with that in mind, here's a few of the things I have written down as far as our next 6 months go. One thing we're working on right now is a survey of the agencies that have PECCs, surveying our current PECCs to find out what their pediatric educational needs are so that we can focus the resources from the grant, as everyone else has said we're carrying forward, how we can focus the resources that we have there on those particular things so that they have the tools in hand to be able to make sure they can improve pediatric care at their agencies. We're going to add a SharePoint page to our PECC registration page online, so that we'll basically be setting up a PECC chat room. This way, the PECCs can log into this and then talk directly with each other, so they can compare their best practices. They can talk about issues they've seen come up. They can talk about successes they've had, so that they can do this directly, so that doesn't have to go through a middleman like myself. And as we've seen from the workshops we did previously, the one thing that the folks who were involved liked best was being able to talk with each other directly, peer-to-peer, and share those experiences and get that information directly from each other. So that's going to be one thing we want to make available, is something where they can reach out directly to each other and they can compare notes that way. A couple additional things we're looking at. We're definitely looking at the idea of regionalizing the program just in general. We're probably going to start a little more direct contact with the folks who've identified as PECCs and try and find the folks who are really leaders in their regions and try to tap into that expertise as a draw for the other agencies in their area. So we're going to try to put an ask to some of the folks who've identified as PECCs that we're going to ask them to help do a little bit of that outreach in their areas and try and bring some more folks on board that way. We're also going to be looking at involving some new organizations to help us with our sustainability. In particular, one thing we're looking at is the idea of incentives for agencies, whether it's like an ambulance sticker, a plaque to put in the in their offices, in the squad rooms, and that, those types of things. Figure out what direction we want to go with this, and then try and help, try and bring in some other organizations to help, develop those things, put those things out, and get those out to the agencies that are registering as having PECCs. So that's my short version of what's happened and what's going on next. Thank you very much.
Thank you so much. Great work, and agree with a lot of your comments, particularly about 6 months being a very rapid turnaround time to not only develop, implement, disseminate, and iteratively adapt a program. So I think that brings us nicely to some of the discussions we had on this call about sustaining our work beyond this 6 months. Sam, perhaps it might be a good time, I don't know if you have a slide as a placeholder, but just to comment on this construct of a learning collaborative and how we intend to try to continue interactions, or would you be able to comment on that, or would you prefer I do?
Sure, I can do very briefly since we're short on time. The intent of the sustainability piece is that we plan to make the collaborative more of a community of practice as we move forward, where it will involve not just you all, but all 58 state partnership grantees that can participate, and they will be, so we'll do a quarterly webinar similar to these learning sessions that we've had throughout to help provide support as you continue to meet the performance measure too. Is there anything you want to add to that, Dr. Auerbach?
No, it's just this concept that we're still here to help, and that because
right.
the deadline ended, really our major deliverable is going to be, and will continue to be, getting our lessons learned out to the many other states and territories on how to implement this program effectively, and certainly that will continue to come over time. So I know we are short on time. I really want to applaud everyone again. I wish we could have a virtual pizza and chocolate cake party, but you all really have worked tirelessly, and there's a tremendous amount that we not only have learned in terms of how to complete a rapid collaborative, but also about the future of PECCs in EMS across our country. And really, I think these lessons are going to serve us well over the next 5, 10, 20 years as we begin to implement this model, hopefully in every state and territory. So there's our exploding congratulations slide. Sam, were there other things that we were supposed to hit in the last few minutes here? Any other comments you have in terms of next steps or take-home points?
Yes, so I know we did get started just a few minutes late, so I'd like to turn it over to Sarah O'Donnell from HRSA just for her comments. And Sarah, I don't know if you want to talk about the qualitative assessment piece or not, or we can just email that out to folks. But
yeah,
let's
plan to email that out to folks because we are short on time. But I did want to take a minute and just say, wow, the work that you guys are presenting today is just incredible. I know that it was a really tall ask, and when we put together this funding opportunity, folks kind of raised their eyebrows at us and thought, really, 6 months to do this work? Okay. And we did have confidence in your amazing programs and ability to achieve it, and it's exceeded our expectations by a long shot. So congratulations. I also want to just really enforce that even though the collaborative is coming to a close, we continue to be here to support your progress. This is not the end of PECC by any stretch. So please continue to reach out, and we will continue to reach out to you. And as Sam said, we'll be working towards forming a community of practice. But if you have any questions or need anything in the meantime, don't hesitate to reach out. And my final note is to please, if you plan to submit for carryover, do that sooner rather than later, because we're waiting for them, and the sooner we can start working that through, the better. So thank you again, just incredible, amazing work. I'm so excited to share this up with the rest of our team here at MCHB.
Yeah, thank you, everybody. You've done amazing work and great job. So I will just give us, since we did get started a little late, just a couple minutes. If any of the folks on the phone have any comments that they'd like to make. Hearing none, then we'll just go ahead and adjourn then. So thank you again, everybody. We really appreciate it.
Sam, I'm going to make one quick comment. Thank you for all your hard work, to you and Terry and to Sarah. Thank you guys for your hard work and cajoling, and we couldn't have done this without you, and you guys have really facilitated the tremendous work that's been completed. So thank you so much, Sam, for your dedication and passion, and to Terry and Cassidy and Sarah and others who've supported this effort. Thank you.
Thank you.
Have a great day, everyone. Talk to you soon.
Thank you. Bye-bye.